Hello everyone, we're Group 10 and today's presentation will be over buoyancy and hydrostatic pressure.
Our group members are
Monica Santos,
Julia Perez,
Amber Cavazos,
And Clarissa Olivares.
We hope you enjoy our presentation.
So what is buoyancy? Buoyancy is the ability or tendency to float in water or air or some other fluid.
Oh my god, that's not me.
What is hydrostatic pressure? Hydrostatic pressure is pressure that is exerted by a fluid equilibrium at a given point within the fluid due to the force of gravity. Hydrostatic pressure increases in proportions to depth measured from the surface because of the increasing weight of fluid exerting downward force from above.
Okay, applications to sports. Hydrostatic pressure and buoyancy are applicable to air and water sports, most common in water sports.
Application of buoyancy to swimming. Different factors contribute to how high or low in the water you float. First of all, your body type has a lot to do with your buoyancy. For example, fat floats while your bones and muscles are denser than fat, are not willing to float. Also, the relative size of your lungs to the rest of your body determines how high in the water your body will float. Secondly, the density of the water is another factor. Saltier water weighs more per unit volume, so you will float higher in saltier water, for example the Red Sea, than you would in fresh water. So another application of buoyancy to swimming is that when we're swimming, our lungs serve a dual purpose. They serve for respiration as well as for buoyancy. Some fish have swim bladders that serve to maintain their buoyancy in the water even while fish remain still. But unlike a fish's bladder, the percentage of air in our lungs must continuously change as we breathe. Experienced swimmers control their buoyancy without realizing it by rationing out smaller exhalations throughout the stroke cycle rather than dumping air entirely or all at once, because they've become in tune with the sensation of changing buoyancy. Fully exhaling and fully inhaling will create drastic changes in buoyancy, resulting in instability of body position. So the key to achieve as close to a normal resting breathing rhythm as possible while swimming, in which there is some air in the lungs at all times with slight variability in breathing cycles. This comfortable and natural breathing rhythm will ensure that there's always some air in the lungs and prevents loss of buoyancy.
Do you want to talk, Julia, since you haven't talked to you?
What is about the swim?
Do you want me to just say it?
Yeah, just say it. It's yours.
Okay. So now I'm going to talk to you about how they use technology and the concept of buoyancy in competitive swimming suits. So in the 2008 Olympics, 94% of the swimming races were won by people who were wearing the Speedo LZR, which is shown in this picture. It is a competitive swimsuit that is made of polyurethane. That is a material that has been banned since the 2008 Olympics for the use in bathing suits. The Speedo LZR was co-designed by NASA experts and comes with a built-in corset which improves buoyancy. This corset is compressed, and it compresses the swimmer's body into a streamlined tube and traps the air, hence adding buoyancy and reducing drag. The new rules in effect since 2010 permit only jammer suits from the kneecap to navel for men and from knee to shoulder for women. The fabric must be air permeable, and a suit may not have any fastening devices such as the zipper, in response to many companies who began to create wetsuit-like neoprene suits after the 2008 Olympics. Hydrostatic pressure in swimming. Hydrostatic pressure is the force exerted on the immersed body by fluid molecules. At any given depth, the amount of pressure exerted on all surfaces of an immersed body are equal, resulting in uneven pressure around all joints during aquatic exercises. Water is more than 800 times as dense as air, and because water is virtually incompressible, the pressure it exerts increases with depth. For this reason, it is favorable for swimmers to remain on the surface of the water when doing the swimming strokes, because if a person sinks, an increased hydrostatic pressure on their body from the water will make it more difficult to get back to the surface. The pressure of water on the chest wall during aquatic exercises resists the muscles to expand the chest for breathing. Regular water exercise strengthens these muscles, allowing them to expand the chest for more efficiency, which enables you to intake a greater volume of air when doing land activities.
Hydrostatic pressure benefits in aquatic exercises. In the water, hydrostatic pressure is beneficial because water distributes pressure equally throughout the entire body, resulting in even pressure around joints during aquatic exercise. Water also exerts pressure against the body, acting like a full body support hosiery during water activities. Hydrostatic pressure is useful for hydrotherapy participants who have excessive edema or swelling in certain areas.
Application of hydrostatic pressure to tennis. Hydrostatic pressure helps all types of athletes by using the aquatic therapy method. In tennis, aquatic therapy is used strictly for the pressure from the water by having the athletes practice running and switching position in the water. It has an even amount of pressure toward the body. Therefore, when you get out of the water, you are able to move quicker and easier.
Some of the benefits of hydrostatic pressure in tennis. Hydrostatic pressure helps athletes' muscles recover quicker. When the body is sore, the quickest way to recovery is through cold water immersion, such as ice water baths and stuff like that. The increase in hydrostatic pressure causes a rise in central blood volume and cardiac output, which increases blood flow and the clearance of waste of products. For example, when athletes are injured, they are put to do pool workouts because it helps to reduce swelling and will lead to regain a full range of motion in a quicker amount of time, which will lead them to a quicker recovery and back to their sport.
Aquatic therapy and the athlete. Like tennis players, baseball athletes also use aquatic therapy to help recover from sport-related injuries. Aquatic therapy is also used for training in order to enhance the player's performance by having them perform exercises in the water in which hydrostatic pressure exerts continual forces on all submerged body areas, which help improve strength, agility, flexibility, speed, and endurance. Buoyancy creates a sense of weightlessness and is changed depending on the depth. Hydrostatic pressure also increases with depth and causes the blood flow to centralize. If hydrostatic pressure raises higher than diastolic pressure, swelling will decrease at an appropriate depth. And then here's a case study. A 23-year-old male baseball player had surgery to repair a rotator cuff and glenoid labrum tear. Post-operatively, he was limited to 90 degrees of shoulder flexion and abduction range of motion. Aquatic therapy was used as a form of rehabilitation. Benefits of aquatic therapy. The buoyancy of the water helped assist, resist, and support shoulder exercises while maintaining range of motion and strength of the elbow and wrist joints, which helped increase range of motion and increase strength of the rotator cuff. And here are quotes from the MLB experts. First, I'll be quoting Patrick Service from the Cincinnati Reds in regards to aquatic therapy. The underwater treadmill is extremely useful. We get guys moving by using a buoyancy suit. or by lowering the treadmill deck, unloading up to 90% of their body weight. We get them moving as quickly as possible. It makes a huge difference. And this next quote is from Ryan Bitzel of the San Diego Padres in regards to the aquatic therapy. The natural resistance that water provides has been very effective in getting our athletes started on their shoulder strengthening exercise at an earlier time frame. And this last quote is by Jimmy Southard of the Seattle Mariners. It's the same with ankle injuries and hamstrings. Because of water's buoyancy, our rehabbing athletes can still get a really solid cardiovascular workout without putting strain on the joint.
Thank you, everyone. We hope you enjoyed our presentation. That's for the bloopers.
Okay.
Oh, sorry. Jeez, try to have a good time. Application of
Thank you all. One, two. Give us an A.